heartily welcome the entire wellness community here who are assembled to make a very special session of the ICC Crack the Wellness Code happen. Today's session is very special because we are in the age of information, and misinformation and disinformation have created a havoc. So let's get our facts right. Today's session is focused on the Delta variant that has been causing a lot of anxiety worldwide, and in San Francisco Bay Area being no exception. My name is Vidyangi Patil. I am a CWC wellness champion, also an author, a healthcare professional, a startup advisor, assuming several roles in the Bay Area. I have been associated with CWC proudly since its inception, and I'm very excited to see all the activities with which it is growing with the pan US and global outreach. CWC is led by its three co-founders, Dr. Pankaj Vich, Naren Bakshi, and Somnath Chatterjee, along with 200 plus wellness champions who offer a platform to crack the mind-body wellness code of the community in San Francisco Bay Area. It has been championed by 17 doctor patrons, and the list of doctors associated with CWC events and activities exceeds 90 plus. It continues to grow every month. CWC also has an alliance with several partners in Bay Area and across the United States, including RPO, South Asia Heart Center, PCRM, the True North Foundation, Stanford Seacare, Frost and Sullivan, UCI Institute of Future Health, and several service providers. From being a program of ICC, which is again the largest community center in North America for South Asians, it has expanded swiftly over the past 3 years to a global audience with participants from over 20 plus nations. Its wellness ecosystem is made up of 200 plus volunteers, health heroes, support groups who are offering resources, wellness practices, tools, and networks. With 135 plus events by now, which is incredible, there is a huge library of content which is steadily increasing to match the community needs. Do check out the website crackthewellnesscode.org. It's a comprehensive platform presenting CWC's wellness ecosystems, events, programs, and content along with membership and marketplace coming up in a very big way. If you would like to contact the team, please write to them at info@cwcicc.org and you can become a member. Also, let us know if you wish to offer any product or service in the CWC online marketplace. And if you wish to donate for the CWC digital initiative, there are multiple projects which are underway. You can please contact Soumya, and Soumya has just shared a link in the chat, and you can access that link to donate to this initiative. So with that, let's now turn to today's much awaited session. Back to school amid the spread of Delta variant is making parents really anxious. What's the reality? What are the facts behind the situation? Are we really fully informed? With so many sources of news and information, which can easily confuse the parents and people who are thinking about getting vaccinated when it's about time. Let's talk to the adult and children expert here. We have several millions of children heading back to school in person, with many for the first time in more than a year. We face a confluence of events worrying parents, educators, and health officials. So adults are also not spared with this extremely infectious Delta variant. And this is spreaded by unvaccinated, immunocompromised adults. And that is why it is high time everyone says yes to vaccination. So without further ado, to unravel some of the mystery behind this Delta variant, what it is all about, and to get to the core of the challenges our healthcare system, our professionals on the front line in education institutions and healthcare institutions are facing, we are truly fortunate to have two dedicated experts here. We have Dr. Nimisha Mishra, who is our subject matter expert. She is from the Infectious Disease and Internal Medicine Department of the John Muir Medical Center. She is also a member of the Infectious Disease Society of America. And interviewing her and sharing his insights would be Dr. Navneet Singh, one of our longtime patrons of CWC community. He's a pediatrician who has done his pediatric residency at Stanford University. And he specializes in general pediatrics at the Sutter Health Palo Alto Medical Foundation. So without further ado, I would like to invite Dr. Navneet Singh to take the stage, and please introduce us to Dr. Singh.
Thank you very much for that wonderful introduction, Vidyangi. I appreciate it. And thank you very much to Dr. Nimisha Mishra for joining me for this presentation. And thanks also to all the members of the CWC for creating a forum in which we can really spread information, educate, inspire, empower. We're 18 months into this global pandemic. This is, for many of us, the roughest time that we've ever lived through. And I think one of the things that we all know from the very beginning of this pandemic is that it's a rapidly evolving situation. These are phrases that we've heard from the beginning. Things are changing, things are evolving, numbers go up, numbers go down. We see new variants. So I think one of the main things that you brought up, Vidyangi, is for me as a general pediatrician, I've been in practice for over 20 years. I think a lot of my families see me as their hub. There's so much information that's there on the internet, on the news. It's hard to decipher, as you said, what is correct and what is not correct. So I feel like my role and responsibility is to try to assimilate the information and to pass on the information the best that I know it. But at the same time, especially at this time, there's a lot that we don't know. And I think part of what we have to just kind of understand and accept is that things are changing. There's things that we know, there's things that we don't know. This is, of course, with the Delta variant, I think a very timely topic that we're having right now. Of course, as we all know, we are unfortunately in the midst of a surge. It's affecting kids as well as adults. So in the week of August 19th, we had a total of 180,000 kids that got infected with COVID that week. That's the second biggest wave that we've seen for kids. The last time that we had such a big spike was in January of this year, when 211,000 kids were infected. So, this is, I think, a very timely topic. Certainly as a general pediatrician, one of the main questions that I'm getting from my parents every day, and this is a very good question, is how worried should I be about my kids going to school? So, this crosses different strata. It can be little kids who are going to daycare and preschool, who are not able to even wear masks and are not necessarily the best at social distancing. It can include older kids who are going to elementary school or middle school who can wear masks and social distance but are not vaccinated. Kids over the age of 12 who may be vaccinated. So there's a lot of different kind of variations that we see. But, I think a lot of parents are very concerned about the fact that their kids are going to school. Many of them, their kids do not have the vaccine. And, this is in the intersection of the fact that we're going through a big surge right now with the Delta strain, which we know is very infectious and very contagious. So as I have these discussions with my families, one of the things that I emphasize is that there's no easy answers to this. And I think it's very important to individualize what you do for your family based on a host of factors. Is your child vaccinated or not? Can your child wear a mask or not? Are there other people at home that are vaccinated or not? Are there people at home that are immunocompromised? So I think there's a lot of different factors that we have to take into play. One of the other things as a pediatrician that I've definitely seen is the impact that COVID is having, not just on the physical health of children, but on their social and emotional health. So, as you said, Vidyangi, for some kids, this is the first year that they're even going to college. I'm sorry, not college, to school. I do have families that definitely their kids would have gone to daycare or preschool, and they have not been able to do so because of COVID. And we know that kids develop very rapidly. We know that kids love being around other kids. So all of us as pediatricians are concerned about the social and emotional ramifications that COVID is having on a child's development, given the fact that many kids have not been able to socialize and develop in the ways that they normally would. As I mentioned, with young kids not being able to go to daycare or preschool, older kids not being able to go to school. One subset that I think is getting kind of especially hit with COVID and the social and emotional effects of this, something that I see, as a pediatrician, is teenagers. So one of the things that's been really hard with COVID is feeling connected to other people, being able to have that social connection. Developmentally for teenagers, this is a stage in life where social connections are extremely important. Teenagers care a lot more about what their friends think sometimes than what their parents think. And the fact that we have teenagers who haven't been able to go to school and haven't been able to have sleepovers and haven't been able to play sports together, for a while, can cause significant impact in terms of their mental and emotional health. That's the reason that we've seen a huge uptake in terms of things like anxiety and depression, even suicidal behavior, unfortunately, in our youth. So, I think it's important for us to think about all the, kind of medical consequences that the COVID pandemic has had, not just physically, but also in terms of the social and emotional ramifications. In terms of COVID itself, just kind of broadly, one of the things that we do know, since we have been going through this pandemic for about a year and a half now, is that fortunately, kids do not tend to get nearly as severely affected with COVID as adults do. So we have more and more data that shows that kids definitely don't get hospitalized as often as adults do. Very fortunately, there's much lower rates of mortality for kids that get sick. So, I think the science is still unraveling the why, but, overall, kids do tend to fare much better with COVID infection than adults do, which I feel very grateful for as a pediatrician and also as a parent. But, that being said, there are cases of kids, unfortunately, who do get sick and, who have really bad outcomes. In my own personal experience, I do have several children during the past 18 months, several of my patients who have contracted COVID. I will say that not a single one of them has needed to be hospitalized. And I will say that many of them have done quite well with very mild symptoms. I read a statistic once that said that about 40% of kids who get COVID actually are asymptomatic, which is pretty amazing. So, fortunately, this does not overall tend to be a severe severe disease for kids. But of course, there are cases of kids who can get really sick. You may have heard about MIS, multi-system inflammatory syndrome, which is, when kids get COVID and actually get quite ill. Fortunately, those cases are very, very rare, usually in like much younger kids, but, there are kids that can get quite sick from COVID. So again, that's my perspective as a general pediatrician. I'm going to hand it over to Dr. Nimisha Mishra, but I appreciate the opportunity to participate in this discussion.
Hello, everybody. Good evening. My name is Nimisha Mishra, and I'm an infectious disease doctor. Thank you, Dr. Navneet, for the introduction and for the, discussion about kids. I am an adult, I'm an internal medicine physician, so I mostly treat adults. So it's always good to hear from the little kids' point of view what all is going on. So yes, the data is, we are all impacted. Like for a year and a half, we've all been dealing with this COVID pandemic. And it's interesting how this, like it was already going the way it was going. We were just starting to see a little dip and we were starting to take a little breath. And then this whole thing changed by the Delta variant. So I think it's important for people to understand why it's different and what's new about it, because many people will say we've been dealing with it for a year and a half, what's new? So that's what I think we were trying to talk about. So I did try to put together some slides so that people who are listening in can get some perspective of why all doctors and why all of us are so worried and why we are seeing what we are seeing in the news. Because I guess pictures say 1,000 words, that's why. So I guess if we can start off with the slide, Vidya. Okay. So, all right, thank you. So that's like, so I wanted to say is like, when we started off, it was this one COVID variant, and it was now it's being called the ancestral variant. And like any other virus, so COVID is not different in this way. I like any other variant, any other virus, I should say. Every virus, all it does, it keeps on changing all the time. So that's what all viruses do. So that's exactly what the COVID virus is doing also. So it keeps mutating and changing all the time. But what happens is there are certain changes that will take on a life of their own, and some will just mutate a little bit and not be anything different. So that's why we are talking about these different outbreaks, like they're being called alpha, beta, gamma, and then this delta variant. So I think there was a lot of confusion in the world because this is an Indian strain or this is the UK strain. So they have come up with these names. So that's why this Delta variant is called this B1617.2. So any other numbers like after this, I think there's a Delta plus variant also, which has come up with a B16.17.4 kind of thing. That's why those numbers are there. So next slide, please. So, all right. So like Dr. Naveed was telling before, so I think the number change that happened in children kind of came in August, but where the CDC started seeing, this is how they track, the number of cases and number of deaths in these two pictures you can see. So, when it started off last year in April, and then the peak was during the December, January time. And then as you can see, the cases happen first and the deaths kind of lag behind. The curve always lags behind about 2 weeks from the cases data. And then there is this striking number that drops over here in January, as you see. I think that is where we started seeing the vaccine kick in. So you can see how the numbers started going down, and then it kind of plateaus a little bit, and then it got down even lower, interestingly, in April. And then in early July, actually July 6th, people were starting to, relax even more. You can take off your mask. Things were kind of getting like, very relaxed. And then you see on this curve, it seems like a very little blip on the end, on the right side edge of this curve. But if you blow it up, you'll see in the next slide, please. So you'll see how they blew up this right edge of the graph. And by statistical, like epidemiologic numbers, 50,000 cases are anything more than 50 is called like significant. So you can see between July 6th and July 28th, in just 2 weeks, there's a 400% increase. That's how many cases increased within 2 weeks. So that's like really significant. So I think that is what caused this panic and alarm, like there's something different that's happening. It's not just the regular COVID virus that's going on. So that's important. Next slide, please. And this is the same data being shown in a different kind of way, that they showed that the nationwide cases, how steeply they rose in 2 weeks by 400%. So if you see this, the map on the left-hand side, like only 24% of the counties had substantial to high level of transmission, which is in red and orange. You can see those, about 24% July 6th. And then 2 weeks later, the whole thing is just lit up. Like the whole thing is like red almost, you can see. 67% of the counties are involved. That's how fast it spread. So of course, like there's something different. So one slide, yes. Next slide, please. Go ahead, yeah. So, and then this is kind of another way of showing what I was saying, that there are different variants. So as I was saying, the B1.617.2, that's our Delta variant. So that's in this dark orange. So you can see like initially this B117, that's like the alpha, that's the alpha variant, that was the UK one. You can see that that was more common in April, how that beige one kind of keeps shrinking. It's shrinking and shrinking from April, and how this deep orange is kind of just filling up the screen. The whole thing is filled up with this Delta variant. So this last is like July 17th. And then in the next slide, please. You'll see this last one is in August 14th. So it's like 2 more weeks go by, and you'll see the whole thing is full of this Delta variant. So this dark orange, well, there's another darker orange on the bottom. That's actually the Gamma one. That's another one that is kind of staying the same. It's not going away. It's kind of staying the same. But this one is definitely like more than 90% at this point is all over the country. It's 90% circulating around. That's why it's so, it's just taken all over. Within 2 weeks, it spread that much. So, all right, next slide, please. So I think what I'm trying to say in different ways is that the Delta variant is way more contagious, and they've seen that it's actually more, it can cause 2 times more infections. So it's almost not just 2. So if before you were infecting 2 people, now you're infecting almost 5 people. That's how much it's spreading faster. And the only way you can really well, there's many things you can do, but the one thing that we have is vaccines. I guess the vaccine is what protects you from hospitalization, deaths, and severe infections. So next slide, please. So there are a few things to know. I think if we can remember those, is that it's more than 2 times contagious as the prior variants. That's why the chances of catching it are much easier than it was before. And this is not fully vetted yet, but this is being said that some studies like in Canada and Scotland are showing that in people who are unvaccinated, the Delta variant illness can be way more severe than the prior strains. The greatest risk of transmission is still amongst the unvaccinated people. So people who, like most of the people that we are seeing, majority of the people that are getting the infections are unvaccinated people. And it is true that fully vaccinated people can have and are having breakthrough infections, but majority of the times they do not get admitted to the hospital, and their infectious timing is much shorter. So they are less likely to spread the infection to as many people because they're infectious much shorter of a time. They're not that infectious for that long compared to unvaccinated people. So that's something to remember. And then this is actually very important. So, you know, I find this very surprising that even though this was like rapidly done for children between 12 to 17 years of age for vaccination, at this time, only 30% of children are vaccinated. I mean, it's not even 50, it's so low. It's kind of surprising to me because, I mean, I don't understand why, but anyways, 30%, only 30% kids are vaccinated in that age group. And of course, as we know, less than 12-year-old are not even approved for vaccines right now. They're working on it. The ACIP are meeting, they are working on it, but they haven't approved it yet. So, and I think we all understand most important thing is to vaccinate anyone who is eligible. And for those kids, so this is another question which again gets asked many times. What do you do for kids who cannot be vaccinated? I think for them, it comes down to the same thing what we were doing last year before the vaccines even came around. You cannot emphasize how much like social distancing, hand washing, you know, just trying to do all the measures possible to kind of avoid them getting infected, because, you know, even though we say less kids are being infected, but kids are being infected. It's not true that they're not infected. So next slide, please. And then this is like the importance of vaccination. I find this slide very interesting because like for all the people, like, you know, just to kind of put it in perspective, the most vaccinated state is Vermont over here on the right side, like between 65 and 70%. And look at their rate of infections, like 7-day case in 100,000. And then look on the left-hand side at all these like southern states like Arkansas and Louisiana and everything, like they're all so high. California kind of falls somewhere in between, like 50 and 55%. So I think this is a very interesting picture. It kind of shows you the same thing in a different graph. And the next slide is showing the same thing. It's in more like picturesque form. Like the blue one on the right side is kind of sitting cool. The ones on the left are all red and, you know, they're highly infected, they're infectious, they're spreading, you know, the risk of infection is really high on that side too. So next slide. And the same thing in the graph is saying if the vaccination coverage remains low, then the transmission areas, the transmission continues to be high. So the purple areas, as dark as the purple is, you can see those areas are, the vaccination numbers are low, and the high transmission, those are the high transmission areas. So it's kind of going hand in hand, and you know, all these other areas. So what is being like 40% is like, I think they're using off 40% as a cutoff. So I think that's what the purple and the white are showing. Next slide, please. And then this is another slide to kind of put, so this is another thing that has happened from last year is like there's so much data out there, numbers, like how much percent. So I think this kind of crystallizes it for anyone who wants to see, like, you know, how when, so if we see the first numbers on each side, when we came out with these vaccines, this we know this this is the Pfizer BioNTech vaccine over here that they're comparing. So for alpha symptomatic disease, it was 94% effective, and for hospitalization, it was 95% effective. And then if you see for delta, for hospitalization, this Pfizer vaccine is still 96% effective to avoid hospitalizations. For symptomatic disease, they're saying 88% because they are seeing breakthrough infections, but that's still symptomatic disease as in mild symptom disease. You won't be hospitalized. So that is very important to remember, that I think we're still lucky that despite how contagious this virus variant is, the vaccine we have is still very effective. So that is a very important number to kind of remember, that it's a very effective vaccine still. Next slide, please. So this brings me to, again, the take home points. Like if you don't, you know, like whatever I was saying, getting vaccinated prevents severe illness, hospitalization, and death. So that is very important. Yes, because we are seeing breakthrough infections, but they are mostly mild or asymptomatic people. So what it does prevent is severe illness, hospitalization, and death. And besides this, this is benefit to the person himself or herself, but it also helps reduce the spread of virus in the community. So that is very important, but because you have to remember, every vaccine that you take, you are not just vaccinating yourself, you're helping yourself, but you're also helping the community at the same time. So that is kind of like a community service and personal service at the same time. So that's when you get vaccinated, you prevent your own illness and you help reduce the spread of virus in the community. So it's both these steps are very important. So the next one is unvaccinated, go back, sorry. The unvaccinated people should get vaccinated and continue masking until fully vaccinated. So that's something that the CDC is saying, that till you get a vaccine, please stay. I mean, they're saying masking for everybody anyways, but if you're unvaccinated, then please stay masked until you get fully vaccinated. And with the Delta variant, this is becoming even more urgent. The highest spread of cases and severe outcome is happening in places with low vaccination rates. So it's very important. Next slide, please. So, and as I said before, Delta is more contagious than all prior strains. Some vaccinated people will get breakthrough infections and they become contagious then. Despite this, the vaccinated people represent a very small amount of the transmission occurring in the country. And mostly all hospitalization and deaths continue to be among the unvaccinated. So that's important. Next, please. In areas with high transmission, CDC recommends everyone, including vaccinated people, wear a mask in public indoor settings to prevent the spread. And CDC recommends community leaders to encourage vaccination and masking to prevent further outbreaks in these high-risk areas. I guess that's what Dr. Navneet and I are doing right now. And it also recommends universal indoor masking for all teachers, staff, students, visitors to K-12 schools, regardless of vaccination. Kids are to return to school with layered prevention strategies in place. That continue to say. All right, next slide, please. So again, the most important point that I did not mention enough before is please vaccinate, vaccinate, vaccinate. That is the one thing you have to do. There's very few reasons where you should not get vaccinated, very, very few reasons why you should not be vaccinated. So, you know, like when we talk about the armor, body armor, you're going into war, you have to wear some protective armor. This is your armor. If you don't have that, you're going into battle without the armor. That's how you should think about it. Thank you. That's the end of my slides.
Thank you, Dr. Mishra. That was a really, really informative. I appreciate, the very thorough discussion that you had there. Like you said, a picture says 1,000 words, and with all the color maps and everything. Certainly, Dr. Mishra, as a general pediatrician, even before COVID began, one of the main reasons I chose to go into pediatrics was because of it's such a good source of preventative medicine. And one of the main things that we can do as good preventative medicine is immunize our kids.
Yeah.
So, for the last 20 years, I've been talking to parents about the importance of vaccination, whether it's measles, hepatitis, tetanus, and, now here we are with COVID. So a couple of questions I had for you is the data in terms of 30% of, the 12 to 17-year-olds getting vaccinated. I was curious, is that national or is that local? And then the second question I had for you, which is a concern that I have from a lot of parents. And again, I think one of the things that you and I are probably hoping to do in this discussion tonight is even if there's a few people that we can get to get their kids vaccinated, that'd be great. It's a win. Of course, parents do have some good concerns about the side effects of these vaccinations. I've certainly had parents asking me about any kind of long-term effects that we're not aware of. We haven't seen what this vaccine does for long enough to know if it's going to cause any problems to my child. I've had parents ask me, is it going to cause any issues in terms of their reproductive abilities? I've had parents ask me about, blood clots. So I was wondering if you could just speak to those things.
Yeah. So yes, yes, I think every time vaccination comes up, I know I'm not like we do our kind of vaccination, but it's very important. Childhood vaccinations are so important. Like if you think back, when you read about how many children died from cholera or how people became whatever from polio, when you think of those numbers, the morbidities, it's like, it just boggles the mind. I mean, vaccines are so important that yes, being worried about side effects is definitely important, but it's like, I think where people do feel nervous is the fact that the vaccines came out so fast. That's what I think makes people very uncomfortable, that it came out within less than a year. They started making it in March and they rolled it out already into arms by December. So that was really fast. But I think the point is that the science behind it is very solid. It's not the first time that these vaccines have been made. They've been made for Ebola and other things. So I think the mRNA science itself is not new. So for that reason, it's not something that, it's just like we're just taking something with nothing. And there is this effectiveness that has been shown 96%, 98%. I think even 88% is pretty good. So those things are all there. And then the side effects, yes. I think all prior vaccines used to be, studied for 2 years, 5 years. Here, there was no time. There is no time. So I think what they saw, like the short-term effects, we definitely know is like when they gave the vaccine to the children, and I think the antibody response that was seen was similar to that was seen in the adults. So they saw the same, but the reaction was no different. I guess they were all reactogenic. It's the same thing that I had some reactions too, like you had some local pain, you had some axillary pain, you had some fever, some myalgias for some time. It all was self-limited, went away within less than 24, 36 hours. So I think those were the least kind of symptoms. Um, I think there has been a lot of press about, so it's kind of like you have to take things in numbers, because there was this description of what I think, the myocarditis that was described because of the Pfizer vaccine. So I think um, that was kind of interesting in the sense that myocarditis is not just seen because of a COVID vaccine. Myocarditis is something that is seen from many different viruses, and mostly it's seen in more boys, young boys. So, but then the number wise, the way it was is like, I think the number they showed was 36 kids in a million got that side effect. So it's like you have to see, and it was symptoms were mild. None of the kids were, like, most of them resolved by simple like non-steroidals or colchicine. They didn't need any severe medication. So I think those things are, the side effects are so minimal that I think there shouldn't be so much hesitancy. It's like, my kids took it, they didn't have any problems, they just did fine. But I mean, the number is so small, the 36 in a million is so little a number. And I think there's one slide, if Vidya can show me the last slide that was on my talk about myocarditis. It just puts it in perspective, like how many things you prevented, the hospitalization numbers. I think I have them, it's a problem. It's like for every, for like, if there was 50 cases of myocarditis, you prevented like 12,000 cases, 12,000 cases of, yeah, this was the slide, the last slide I was showing. So if you were to see the males, so because this was seen, myocarditis was seen mostly in boys, in young men, because that's how it's just more common there. So if you see 12,000 COVID-19 cases were prevented, 530 hospitalizations were prevented, 127 ICU admissions prevented, 3 deaths prevented. So if you put those things in perspective, the 50 cases of myocarditis kind of fades away. Not to say that it's not serious, it's just that it was a mild case of myocarditis. Little kids, they had some chest pain, they went to the hospital, they were kept there, they were monitored, they were given some what we call non-steroidal anti-inflammatories, and they didn't have any interventions, and they went home. They're doing fine. I mean, in the long run, if you think like, we don't have, I guess not enough time has passed by to say, is the myocarditis from the vaccine worse, or would COVID-19 cause something, way worse? An MIS syndrome would be way worse. It would be hard. So I think that's what I was trying to say. As far as clots are concerned, that has been described more with J&J vaccine, and that's mostly for young women. So that's not relevant to little kids. I mean, not little, but to adolescents and young people. And that also, the number is like 11 cases or 11 cases in a million or something. So the numbers are really very small compared to the risk that you're taking without getting vaccine. So I guess it's risk benefit ratio is what comes down to it.
Yeah, thank you for that answer, Namisha. One of the things I always like to tell my parents is that in addition to being a parent, a pediatrician, I'm also a parent. As you said, I have 2 kids, a 13 and an 18-year-old, and I always tell them I'm going to treat your kids exactly like I would treat my own children. Both of my children have gotten the vaccine, so that's always something that I, just like to bring up in the exam room. The other thing that I like to bring up to my families is, as you kind of mentioned, is the science of this. The fact that this is not a vaccine that gets into the nucleus of the cells. It's basically just providing a blueprint. I think the technology from a science standpoint is fascinating. The technology is so cool that it basically just provides a blueprint for your body to make an appropriate immune response without any kind of, long lasting effects. So related to that, Dr. Michelle, one of the questions I've been getting a lot is actually from people who are very excited about getting the vaccine for their kids, and their kids are too young. I keep hearing, when is my kid going to get the vaccine?
Yes,
So I know, of course, there's clinical studies that are underway.
yes,
I think that the 5 to 12-year-old age group will be the next to roll out.
yes.
I know there's no set answer to this, but as a specialist, do you have a sense of when we might be able to see authorization for 5 to 12-year-olds?
Yes, I think the one last meeting when they authorized the additional dose for the immune suppressed people, that's when they said I think that data is going to come out end of this year or early next year. So I'm expecting it later this year. So that's what they're projecting. So I hope they're saying later this year. I'm hoping by October or November is what I'm hoping for,
Mhm.
because the data is out there. They're working really hard on it. So I think they're getting close. So
Yeah,
not too much longer to wait for that.
yeah.
Yeah.
And then kind of related to that, one of the questions I've been getting recently, and I'd love to hear your response as well, is parents asking about off-label use of the Pfizer vaccine for their child that's under 12 years old. Once
Yeah.
Pfizer vaccine got approved by the FDA,
Yeah.
some parents started wondering, well, can my 9, 10, or 11-year-old
Yes.
get it?
Yeah.
I've been telling them that the American Academy of Pediatrics is not recommending to do that because one of the
Yes.
things that they're really trying to figure out is the appropriate dosage
Yes.
for
Yeah.
younger children, and likely the dosage will be less than what's given to adults, but would just love to hear your
Yeah.
feedback on that.
Yeah, I mean, it's the same. I mean, I'm hearing a lot too, like lots of people are asking the same question, like, my kid's like 11, what's the difference? I'll just do it. But I feel like, again, we are dealing with all these immune issues. Little kids' immune systems are extra strong, extra reactive. So I think it is not safe till it is approved, till it has been studied in a clinical setup, because again, things can happen. So I would recommend not to give it to anyone who's less than 12 right now. It's like, I guess we've traveled this far, we can give it 3 more months, it's coming really close.
Mhm.
So I would not recommend giving it, because yeah, that's the thing, like, um should we give a lesser dose is my concern. That is, I think, going to be my question too, because 6-year-olds are really much smaller than 18-year-olds, so I would not give it. That's what I would say too.
Okay.
I agree.
I'd like to heartily thank Dr. Mishra and Dr. Singh for this amazing segment. There was a lot of complexity you handled with ease. I think the audience have follow-up questions based on that. But before that, I would like to quickly thank a few doctors here who are on the call, who have been anchor of support for CWC. Uh, Firstly, I would like to thank Dr. Padma Srinivasan, Dr. Monica Chug, Dr. Rashmi and Sunil Jain, and Dr. Naras Bhatt for being on this call. I hope you enjoyed this segment, and also if you have any questions or any additional thoughts, please feel free to add to this session after the Q&A. So let's get on with the audience questions here after those amazing questions from Dr. Singh. The first question is from Dr. Monica Chuk. Okay, great. If a fully vaccinated child gets tested COVID positive, quarantines, and has mild symptoms, what can be the long-term health issues we should be careful about?
So I think the one thing, that's a good question. So most of the breakthrough cases that I have heard or read about is not in children. It's mostly in old adults with immune suppression. That's what mostly we are seeing. So is it happening in children? I guess I don't see kids like as a physician, so I don't think it's happening in children. But the most important thing is, if the child gets infected, you know, like I was saying, whenever you have the Delta variant, you are going to be transmitting it around too. So you may have a mild illness, but you will be infectious to other people. So little kids, maybe there are grandparents around, or there are, other immune suppressed, maybe parents are immune suppressed. So I think that would be more of an issue. The child may get better, but then, the child it should be taken in consideration, stay away from the grandparent or anyone else who's sick, so that, you don't go infect someone else. And the other thing that I think is important to remember, which I think I didn't mention, is the multi-inflammatory syndrome that is described. That is something that happens after, mostly it is happening maybe 2 to 6 weeks after a child has had COVID illness. And usually most of these kids have had very mild illness. So there's no way to differentiate if this is going to happen 2 to 6 weeks later. That's something we don't know. So I guess long-term wise, it's hard to say if that can happen. It's rare, but it can still happen. So
Yeah, I think Dr. Chug has a comment. Dr. Mishra, you're right. It was for a 22-year-old young adult. So
okay, yes,
that's
yeah,
what she was talking about.
okay,
So,
okay.
Dhawal Shah, would you like to join the call and speak? I think you have questions.
The question I had was, you mentioned there are some people who cannot take the vaccine in elders, like people who have Guillain-Barré syndrome and stuff like that, because the vaccine may create autoimmune response. So what is your best advice for them? What should they do? Of course, their better halves can take the vaccine, right? Because at least the severe case will be saved for them. But
Yes.
what is your advice on that?
I mean, so the thing is, whenever we say if somebody cannot take a vaccine, then you have to think of it like the way you said, everybody around that person should make this kind of what we call herd immunity. They should try to make this cover around that person. Whoever is living in his bubble should try to be vaccinated. And then you have to have the same layered protection of like masking, hand washing, social distancing. If anyone is mildly sick, stay away from them. So it's kind of like whenever you can't vaccinate, you should think of how we were living in the pre-vaccination time. I think it just comes down to that because, you know, there is no other way. I mean, this virus is gonna kind of work its way out till we get to what we call herd immunity, like in the system. So the whole country, it's almost like till the whole country doesn't achieve herd immunity, we will keep seeing like surges and surges, kind of like that. So I feel like for that one person, it's his family members who can protect him the best, I guess. That's the answer, short answer.
The family members could carry, if they go out, they can still carry the virus to this person, even if the family member is vaccinated with the best vaccine.
People, yes, I mean, there can be breakthrough infections. Yes, that is true. So, you know, this, any one of us, like mostly the breakthrough infections are happening in people who are immune suppressed, but it can happen to others also. And most of the times it should be mild illness. So yes, when you're saying this one person who is not vaccinated, his wife or husband, the spouse goes out and gets a breakthrough infection, yes, technically they can be infectious at that time, but they should have some symptoms, so they should know when to like separate out from that person.
Okay,
That's
and
like social distancing. Yeah.
thank you. Of course, Vidya, take over if needed. But rather, the quick one is today, since Pfizer has been approved now by FDA, full approval. Today, if someone had to, I mean, tomorrow, if someone had to go and get the vaccine, Pfizer versus Moderna versus J&J, how would you say it's a no-brainer, take the Pfizer because it's a full approval versus
So, you
J&J,
know, yeah, so
especially?
this is something that like I think all vaccines at this time are good. So, you know how we get into these technicalities, is it this vaccine, this number, this number? But, you know, if you are living in a place where there is only, you know, X vaccine available, I would go and get it. I wouldn't wait for only the Pfizer vaccine to show up in 6 months because you don't have that kind of time.
Right.
All vaccines are effective. Whichever ones have been under EUA approval, they are all effective. That's what I would suggest. Like if you, I mean, I don't think most places that, well,
But if
I
all
think,
are available, what if
yes.
all are available? I'm asking a tough question. Yeah.
Yeah, I
What
mean,
if all three are available? Then which one?
the true answer is any of them, what you like, you know, whatever you prefer, you can take. That's
Okay.
the true answer. Yeah.
Awesome.
I don't think,
Thank you, Vidya.
yeah, I don't think it matters.
Okay. Thank you, Vidya. Thank you.
Yeah.
Thank you, Dhawal, for all those insightful questions and insightful answers from Dr. Mishra. We have a lot of questions about vaccines here, but before that, quickly, I'll club two questions on increasing immunity for children. Do multivitamins and good nutrition help in increasing immunity against the Delta variant? Dr. Misha, would you like to add to this or comment about this?
I think this is something like, good nutrition helps for anything. It's not just for Delta variant, it's for any infection, any virus, anything. So I don't think anything is special as far as like eating wise, or, people have their own like herbal remedies, whatever. I don't know. I mean, if you're taking a multivitamin, that's fine. But I think good, healthy nutrition is great. Um, I don't know. I guess Dr. Singh probably gives more advice also, personal advice.
Yeah, this is
Yeah.
definitely a question that I've gotten even pre-COVID.
Yeah.
Even for my families where their kids are going to daycare and preschool, and they get a cold and be okay for a few days and go back to daycare and get another cold. Um, would love to get your input as well, Dr. Mishra. But usually, what I tell people is that yes, there are certain vitamins and minerals that I think do help to boost your immune response. Things like vitamin C, vitamin D, zinc. I think that those have been shown to be effective in terms of helping your body's immune response. Another thing that I think we're finding out more and more the importance of is what we call probiotics, all the good bacteria that are in your gut. I think we're learning more and more about the importance of probiotics in terms of your body's immune response. So I do think good nutrition is good because I think that's the best way for your body to get all these good vitamins and minerals and probiotics. But I think a lot of kids are picky eaters. I know my kids still like do not eat what I want them to eat necessarily. So in cases like that, I think sometimes giving a multivitamin supplement, just to make sure that you're covering your bases is a reasonable approach.
Awesome. Thank you, Dr. Singh. That was, I think, a holistic answer. I would add exercise. I don't know if kids can get exercise. I try to get my daughter to play outdoors, in an open space. With that, I have few more questions on the vaccines here. So the first question is by Nalini Shindpale. She says, FDA approved Pfizer vaccine has been released fully recently. How come it proved down the line there are no side effects? Is there a concern about vaccinating kids?
It's just important to emphasize that when vaccines get approved, even if it's through EUA, they do go through very rigorous testing. That's why we're still waiting for the vaccine to, become available for the 5 to 12-year-olds. It's because they've been doing clinical trials for a while, and they really want to make sure that they follow these kids over a period of time and make sure that it's safe.
Okay, fantastic. Thank you, Dr. Singh. And any news about the booster shot of another vaccine? It's a question by Greta Sheshadri.
Yeah. So, so this is something that is being asked almost for past 6 months. So there is a difference because it's being confused. Like like recently, what was approved was as and what we are calling it an additional dose. That is not considered a booster dose. That is being an additional dose for the immune suppressed. And the people who are coming in that category are like solid organ transplant, HIV, and people who are like on steroids or other like disease modified, like biologics kind of. So it's a very specific category of immune suppressed people, because what happened is for them, even 2 doses of vaccine, they kind of, the antibody response their body generated was 5 to 10% or 5 to 20%. Like if my body generated 96% reaction after 2 doses, their reaction was 5 to 30%. So it's kind of like somebody who didn't even have that response. So for them, it's a different thing because it's not really a booster. It's more like another response to see if it's going to bring it up. So that is an additional dose. So I think that is where it's getting confused because people are thinking it's a booster for everybody, but that is a very special category. And the booster is more for people like front line workers like that, me and Dr. Singh, kind of like or people who live in nursing homes, or so those are the booster things. So I think the next thing that is, I don't know which one's going to come first, either 6 to 12 vaccination, 6 years to 12 years vaccination, or the booster. I think there is a race. I don't know which recommendation is going to come first. One of them is going to come soon. Both of them, they're working on both of them. So I'm sure there will be a booster coming, but will it be the same dose? Will it be a little different, with I don't know, those things are still pending. So I don't know yet.
Awesome, great. Yeah, we know virus does not discriminate.
Yes.
So we have to have vaccines for all age groups, and I
Yes.
think both should come soon, as soon as possible. So,
Yes.
so thank you again, Dr. Mishra, for that answer. So we have a question from Dr. Padma Srinivasan here. She says, previously I heard from school officials and doctors that children bring COVID from home and not likely to get it at school. Recently, Mount Diablo School District had several COVID infections from a teacher. So, how do you comment about the school and home infection spread scenario? What are your thoughts?
So the way it's been seen epidemiologically, yes, the infections mostly come from the home. That is how it has been seen in general, because that's where we spend the most amount of time. So it is true that most of the times the infections are picked up at home. I don't know what the details are about this. I did hear that there was some school, there was a teacher who was infected. I did hear that. I don't know the details on that. So, I mean, picking up one case scenario, and I don't know, I can't talk to that. But yes, historically, most infections are carried from home. I guess Dr. Singh can give his thoughts too.
Yeah, no, I think that's a really good question. Certainly, I've been having a lot of parents ask me, what about the safety of my child going to school right now? And we had a town hall meeting with one of our infectious disease specialists who's over at El Camino Hospital. And just as you're mentioning, Dr. Mishra, what he said is that when you look at the data, because again, we've been through COVID for, 1.5 years, we have more and more data. His point was that preschools, daycares, schools, they do not tend to be big spreaders of COVID. The majority of kids who are getting COVID are getting it from home, from people at home that are not vaccinated, or large indoor gatherings with family members and friends, again, potentially who are not vaccinated. So, that certainly does not indicate that this can never happen. There's really very few, I would say, absolutes when it comes to COVID. Mainly what there are trends. And, I think that the trend is that, kids generally do not get infected from other kids or teachers. Are there exceptions? Of course there are. But, overall, I think that schools are safe. I've been recommending to my families that I think that their kids should go back to in-person school. And that goes back to what I said earlier, which is that there's really important, I think, social and emotional benefits for a child being in school. The American Academy of Pediatrics is recommending this. So I think you need to, kind of look at it big picture.
Awesome. Awesome. Thank you, Dr. Singh. We have a very interesting question. Is there any chance to combine flu shots with COVID vaccine?
So I think I'll take, yes. So I think, I don't think so. I don't think there's any data like that. I think both are very different kind of vaccines. And with the flu shot, as you know, every year it's kind of a different mechanism of making. So yeah, it sounds like at one point, will it be true? I don't know. But right now, I don't think so. I don't think there is any such move right now.
Okay.
So it would be nice, but I don't think it's gonna happen right now.
Yeah.
So
So,
yeah,
so this whole study of Spanish flu, and how it applies, like it comes in waves, and then I think eventually dies down. It damps. So I guess it's going to COVID is going to be like flu at one point, but until then we have to brace up.
we
So
have to. Yeah, there is one question that I see from Geeta. I guess, can we take a booster of another vaccine? I think that's an interesting question also. I think what she means is, can we mix and match? So I think there is not much data of that. There is a question, I guess she said, can we take a booster of another one? Like if you've taken Pfizer and then can you take a J&J? I guess that's what, I don't know if that's what she means, but that is being discussed quite a bit. So the studies that have been done on that is mostly in, like in the US, majority of the times it's been the mRNA vaccine. So most of the studies here have been the mRNA, the two, Pfizer, Moderna, and J&J. But in the rest of the world, there has been more AstraZeneca and that kind of adenovirus kind of studies. So what they have seen, some studies, that if you take the AstraZeneca vaccine And then you take the third one, you take a mRNA vaccine. So the booster response is better. So that's the answer to that. But, these are all data points here and there. I mean, how is that going to, help us? I don't know yet. So that was the answer to that question.
Okay. Thank you, Dr. Mishra. There's another question regarding some young boys getting myocarditis. How accurate is the study with respect to adults not having the same issue? If there is a difference indeed, what's in a young boy specifically that they get it?
So, it's an interesting thing because myocarditis somehow is seen in young people. It's usually a disease between 12-year-olds to 30-year-olds. That's where, and mostly males. It's not just related to Delta, it's just viruses in general. And why is that? I don't think there is any reason to that. It's just seen like that. So most of the times it's just that age curve. And once people hit 30, it kind of keeps going down to the age of 50. So it's something that is seen with infections. I guess it's to do with their immune response. Like the immune response is so heavy, looks so much that it just kind of causes this myocarditis and pericarditis. So I think it's an immune response. That's the reason why they get it. And why it happens in males, I don't know. I don't think there is an answer to that. And the good thing about this is what I think the reason why most of the people who found this as a reaction to the vaccine, they rushed to kind of report it, was because most of the times, like, for example, if a 20-year-old or anyone, like if a 20-year-old says, I have chest pain, and they go into the ER, and they don't find anything, they find some EKG changes, they'll do a cardiac cath. So I think that's the one thing they wanted to avoid. That's why they wanted to put this information out there, that this may be a vaccine side effect. So once people are aware, then they're not going to rush them to the cath lab. So all that happened to these little kids was they just were put there, they were monitored overnight, they were given some anti-inflammatories, they got better, and they went home. So I think that's pretty much that happened. So
Yeah, and I think another point that I would add to that, which is something that Dr. Mishra said before, but just to kind of emphasize, is that you can't always say that A caused B. It could just be that A and B kind of happened around the same time. And, who's to say if you have 1 million people and a few people get myocarditis, that it was actually due to the vaccine? I mean, it certainly could be. I'm not saying that. But, you can't necessarily say that, it's causation. It could just be coincidence.
mm-hmm.
Yeah, the causation versus correlation, the debate, it's always there. So with that, let's move on to another question. Is there any difference between medicines for COVID and Delta variant?
No, not really.
Not really.
So I mean, Delta variant is COVID. So I think we're still working on it. I don't think there is any. So first of all, whatever we are treating people with right now, they are also, majority of the treatment is with steroids and remdesivir. That's what we're treating like primarily. And there are some other, there's monoclonal antibodies and some other extremely, unique kind of anti-inflammatory pathway blockers is what we're using. So there is still work going on all that. Is there any difference in the medications? Not really. So I think what has improved is, this may be more technical, but I think in the ICUs, we have developed a way of, we know how to kind of manage people better rather than the traditional way. That's what is different, but there is no difference in the medications as such.
Thank you. Thank you for that, Dr. Mishra. There's sort of a complaining tone here. Why didn't the kids clinical phase 1, proactively happen in parallel with the adult study? As we would have the results, and at least EU approves it, perhaps because they're probably quicker than FDA. So that's a question. So do you have any take on that?
I'm sure people are working on it quite a lot. I wish I knew the answer. I mean, you can only, I think things are going really fast, to be honest, to come up with a vaccine, such an effective vaccine so fast. And I think so many countries came up with so many different I think that in itself is a real big feat of science, that you have effective vaccines so fast. To have them approved for kids, the thing is, you have to go into vaccine development. You have to make it into a science where it's you know exactly how much to give for how much response, and to have the minimum side effects. So those things take time. I mean, you have to enroll that many people. You have to give it. You have to at least give 28 days to see if the response is gotten or not. So there is a time limitation. I don't think it's because kids are less. I think little kids are the most important. So probably they are having time. I think there is a lot of time that is taking in enrolling people because they don't have that many enrollees, you know, because I know even for pregnancy testing, most of the pregnant people are healthcare workers. You know, there are not many enrollees to check for how effective the pregnancy vaccine is. So that's why it took so long. So I don't know if for specific reasons, but I know they're working really hard on it. So
Yeah. So so there's a small correction. I said EU, but the attendee says it was EUA, Emergency Use Authorization.
authorization.
Apologies for that. Yeah. Okay. Okay.
I
Thank you.
understood that.
Thank you for the correction.
Yeah.
I think Naren Bakshi wants to, share his thoughts
Yes.
about the AstraZeneca vaccine. He also wants to share his thoughts with the panelists. So Naren, would you like to take the stage?
So, Dr. Mishra, I do absolutely believe in making sure that we all take vaccine. I am 77. I had gotten AstraZeneca in India. That was in March. So this month, with some consultation, I was able to get Pfizer vaccine. And I believe that has been the right thing to do. So any comments you have would be useful. But before that, I also, on behalf of CWC, like to thank Dr. Mishra, you and Navneet, and also our other doctors who are on the panel. All the way from India, we have Dr. Rashmi and Sunil Jain, who are also part of CWC India. We also have Padmaji and Naresh Bhatt and Monica Chok. So thank you, all of you. And Vidyangi, you have been with us almost from day one. So thank you, thank you.
Thanks, Naren. We miss you. Come back soon. Come back here. You need it here. All right.
I'm here.
He's here. Oh, he's here. Oh, okay. Fantastic. Okay, we'll catch up. So with that, I'll just move on to a last few questions here. Dr. Singh, any comments on Indian vaccines made in India?
I don't have any specific comments. I'm honestly just not as familiar. I'm sure Dr. Mishra knows way more about this than I do, but I will say that, Dr. Mishra, you can kind of chime in that my understanding is that the AstraZeneca vaccine is not as effective against the Delta variant as the Pfizer and Moderna. Is that correct?
So, yeah, I do have the numbers. So let me find my thing. So the number wise, I'll kind of say just bear with me when I say it, like with the Pfizer. So this is how they kind of saw how the effectiveness would be with the first shot of Pfizer. If you had only one shot of Pfizer, it was like against the Delta variant, I guess is what they're talking about. If it was like 36% after Pfizer, and after the second shot, your response reached 88%. So you have to have both shots of the Pfizer vaccine against the Delta to have 88% response. So they said that an AstraZeneca, after the first response, it was 30%, and after the second response, it was 67%. So, I guess the 88%, 67% does sound different, but this is what experts say, that in the bigger scheme of things, if majority of the people living in that area are getting vaccinated and are 67% vaccinated also, if there is herd immunity, it would still work out. So the point is, like, if you had, I think what the recommendation is, don't get hung up on the 60%, 70%, 80%, get the vaccine. But yeah, if you have a choice, then maybe try to go for the Pfizer vaccine. But it seems to me that if everybody has in that area, in one city, if everybody has AstraZeneca, then I think you should still be protected. That's what they're saying, that the 67% in reality does not make a difference. But yeah, by numbers, it seems like it is less effective. But, but clinically, it seems like it may not be much different.
Yeah, thank you for that, Dr. Mishra. So Dhaval has posted some facts here.
Yes.
ZY-CoV-D is by Zydus Cadila. It will be available from first week of October in India, and for age group of 12 to 18 years, 12 to 18 years. It's emergency use authorization and has 3 doses. So that's what he says. I guess that those are the facts, and I think people can verify it, people from India. So I have one wrap-up question. What is the take on booster dose again? Kaiser is already giving a booster dose. Is Pfizer and Moderna efficiency going to wear off in 4 to 6 months? It's kind of like you've already answered it, but
Which boosts, again, booster is being used in the wrong term. The booster that they're right now giving is not the booster for everybody. That is for the immune
right.
suppressed. So
Yeah.
that is why people are getting confused. They're thinking it's for everyone. It's not for everybody. It's
Okay.
only for immune suppressed, and the immune suppressed category is very specific. So I think it's even like Walgreens is giving it. So if you go to Walgreens, they have a little checklist. So it's very specific.
Okay. Thank you, Dr. Misha. Thank you
Right.
for the clarification. I
Yes.
think we will wrap up the Q&A session now. And Dr. Singh, any last thoughts? Dr. Mishra, any last thoughts before we wrap up?
I'm sure. I just wanted to, again, give thanks for having the opportunity to have this important discussion. I know that these are very trying times in many ways. It's very stressful for parents to think about anything that would put their kids in harm's way. So, parents whose kids are going back to school, it's definitely a scary proposition. Again, just want to reassure parents that I think that there are a lot of benefits for kids being in school in terms of their social and emotional development, and that schools do not tend to be big spreaders of COVID infection. Um, Totally want to emphasize what Dr. Mishra said, which is I'm so impressed with the science with this, these vaccines. I mean, the fact that there are really smart people that made a vaccine so early on, and that it's so effective. These efficacy rates are against serious disease or hospitalization. The effectiveness in terms of like even just mild symptoms, if you think about it, is even higher. So I think it's amazing that we have these vaccines available. I do really hope that everyone that's eligible will get these vaccines, because at the end of the day, this is a public health issue. As Dr. Mishra was saying, everyone wants to get to some sense of normalcy. The more that we can move towards herd immunity, the more that we can get there.
Sure. Thanks, Dr. Singh. Words of wisdom to be etched in our minds, especially at this time. So the threat is not the virus, really, it's the people, how we treat the healthcare system and the benefits we can avail from them. Vaccination is definitely a must. So we have both panelists vouching for vaccines, and stay aware of what's happening, what boosters are released, what they mean, what it means to your age group, and not only yours, the herd which surrounds you, what it means to them. So thank you both, Dr. Mishra and Dr. Singh, for your valuable time and contribution to the CWC special Delta variant session here.